Welcome to NCHE Presents Leaders Pursuing Health Equity in America. Our nation is experiencing a strong movement for truth, racial healing, and transformation. It's been known as TRHT since it was launched by the W.K. Kellogg Foundation back in January 2016. This movement is advancing in communities, on college campuses, and in business sectors. America must acknowledge the truth. Racism has existed here for centuries, and we can redress it by healing the wounds of the past and charting paths forward that transform our society. Everyone must be treated with dignity and respect. This is essential for expanding health equity in our communities. Everyone deserves opportunities to attain his or her full health potential. For decades, we have focused on the social determinants of health. Today, we fully understand that concept, but now it must translate into action. NCHE is providing a platform for leaders who are taking action, who are working in their communities for truth, racial healing, and transformation. They are reflecting on TRHT's 5 pillars: narrative change, racial healing and relationship building, separation, segregation, law, and the economy. Our communities are creating new narratives about the present and the past that raise expectations for equity, fairness, and justice. This approach is building trust, relationships, and healing across the divides, across racial and class lines. And in so doing, we are expanding the circle of engagement. We are building a critical mass and ultimately a majority and supermajority of people who will unite behind the TRHT movement and transform our country. In the NCHE podcast, we will lift up leaders who are finding innovative ways to generate healing and build the bridge to tomorrow. We will talk to leaders addressing the entrenched legacy of separation and segregation. We will strategize with those tackling the racist policies and legal structures that continue to impede progress. And we will hear from leaders working to create economic opportunities that can stabilize families. Join us on this journey. NCHE Executive Director Dr. Gail C. Christopher is our host. Stay tuned for NCHE Presents Leaders Pursuing Health Equity in America.
Hello, and welcome to our podcast, NCHE Presents Leaders Pursuing Health Equity in America. I'm Gail Christopher, Executive Director of the National Collaborative for Health Equity, and it is my pleasure to welcome our guest. Puni, would you tell us about yourself, the wonderful work that you're doing to support truth, racial healing, and transformation in this country, and also about the unique institution that you're a part of?
Sure. Thank you, first of all, Dr. Christopher, for inviting me to share time with you and these listeners. My name is Kaiwipuni Lipe. I was born and raised in Hawaii on the island of Oahu. I'm a mom, I'm a daughter, I'm a granddaughter. I have two babies. My daughter is 15 and my son is 11. I grew up here on the island of Oahu to 2 parents who definitely believed in all the things that we are doing today. I was hired 5 years ago at the University of Hawaii at Manoa in an inaugural role, supporting our campus in becoming a Native Hawaiian place of learning, a place that is committed to the Native Hawaiian people of Hawaii, and also it's committed to utilizing Native Hawaiian cultural principles and values and practices to support everyone who lives and breathes in this space, to help us grow, to help us heal, to help us connect. And I was fortunate enough 5 years ago to help lead our campus's application to become a Truth, Racial Healing, and Transformation Center, along with the Association of American Colleges and Universities. And I am the director of that initiative as well. The way I sort of look at it is, how are we going to become a Native Hawaiian place of learning without tools to heal and to connect all the things that have disconnected us from being a Hawaiian place of learning to begin with? And the TRHT framework and all of that work really helps us on a path to be able to do that.
Thank you so much. I really resonated with your description of your teenage children almost as your babies. I still describe my adult children as my babies. And so I get that. I understand that. You mentioned the principles of your culture, of the native Hawaiian culture. You know, anyone who's ever visited Hawaii, we feel that. We feel the shift in the environment, in the culture. Could you say a little more about that for our audience, please?
Yeah, thank you. You know, in all places in the world, I believe that at one time or another, there were principles that connected us to each other and to place. For us, in our stories, you know, we know that we are born from this land, that the land, the sky, the seas, the birds, the plants, the animals, that they're all part of our family. We learn this through our cosmogonic genealogies that connect us to the beginning of time. We learn this through our stories and our multiple kinds of genealogies. And so this core principle that is actually really important in Hawaii is this idea of lineage, this idea of genealogical connections. And of course, you know, first and foremost, it is about our familial connections to one another, our biological lineages, if you will. But it really is a lens or a framework that invites us always to be seeking the ways we are connected, even when we're not biologically related. And so that is a core principle that we are trying to teach anyone who is, you know, in our presence, in our space in Hawaii, because, you know, and I'm preaching to the choir here for sure, but we know that, you know, the concepts of race and racism seek to have disconnected us from our ancestors, from ourselves, from, you know, our neighbors, our community, and from land. And so inviting folks to use this idea, the Hawaiian concept is mo'oku oho, but in English, we can, you know, kind of loosely translate it to our genealogical connections. If that is a tool that invites us to seek connection again, and to then understand our role and relationship, and we have certain concepts in Hawaiian that describe the ways that we are connected, the roles, the, you know, the kind of responsibilities that emerge from that connection. Those are, I think that they're very much Hawaiian, but I think that we can find them anywhere in the world. We are lucky in Hawaii that we still have some of that indigenous ancestral memory that invites us to remember, and that we get to tell that story. And hopefully by sharing some of that story with the rest of the world, we are inviting other places and other communities to remember their ways of connecting that are grounded in their places. But we believe it's everywhere, right? It's just a matter of how we can reawaken to that wisdom that exists.
You know, I love the concept of invitation. And it clearly is an invitation, this process of truth, racial healing, and transformation. And it is also such an important reminder that you're expressing of our connection to the land, to our ancestors, to one another. Could you speak a little bit about your understanding of the health benefits of affirming that connection?
Yeah, thank you for that. First of all, I want to recognize one of my teachers, my mentors, Dr. Miguel Guajardo, who helped me think about the difference between an invitation and a challenge. And I think, you know, and in all of our cultures, you know, he being Mexican American, you know, me being Hawaiian, but in so many of our cultures, the ways we really open up and invite people, ideas, you know, worldviews, languages into the space is really important. So I just want to begin with that since you highlighted that.
Yep.
You know, for us, we recognize in our stories and our traditions that we are only as healthy as our land, and our land is only as healthy as the people. And so that very intimate connection, we think of the earth as our grandmother. In our story, she is our grandmother. And so, you know, thinking about, in our TRHT work, we never separate our relationship to what we call Aina, or our grandmother Earth. That is the ultimate sign of health for us, because when we are connected to her, when we are in good relationship with her, that means that our society is good, that we are doing the right things in our human society that then allow us to be connected and then allow us to take care of her so that she can continue to nourish us. So that's like a really kind of core piece of health equity. And from Hawaii, and in any indigenous community, but we'll just talk about Hawaii because that's the only one I really have any responsibility or, dear privilege to speak of at this moment. And then, of course, we know that the physical manifestations of health that happen when we are in good relationship with our aina, with our land, right? That we are eating healthy, that we are, for us, that we are spiritually on track, that we are doing the things in our society that allow us to take care of one another so that we can together take care of the place that we are in. And so I think those pieces of health that we have to experience, that we have to be reaching in order to take care of our land correctly so that she can continue to nourish us, is sort of foundational in the ways that we think about well-being, that we think about what is pono or righteous and balanced. And we're not there yet. I'm not trying to say that we have it all figured out again, because racism and settler colonialism have definitely separated us from some of those practices and some of those values and knowledge systems, and we are trying to repair those right now. Specifically, our place. Go ahead. I'm sorry.
Oh, I'm sorry. I didn't mean to cut you off. But I was going to say, you remind us that it is a work in progress. And, the principles that you're describing, the values, the story that you're sharing, it's the story of the indigenous and the native people of your land. And we know that you're not, the dominant group in your land right now. And so I wondered if you could bring us into your world of this innovation, this sort of creative and at the same time historic perspective, how it's landed in your, in this broader university community, right? Talk a little bit about the risk and the challenges that you have faced as a leader and may still be facing in terms of bringing this agenda, this perspective into an academic setting.
Yes, thank you for that question. So I begin with, of course, saying that we, like I said, we are in Hawaii, we really are privileged for the gift of still having some of this indigenous ancestral knowledge to hold on to. And I really want to recognize, we do over and over again recognize that is a gift. That is a gift that we are not all privileged to have access to, right? I mean, even in my own family, there are pieces of our family that cannot connect back. And of course, in all our families and all the different communities that we are a part of. And so I think that's one of the first things that we always have to recognize when we are in spaces. University of Hawaii at Manoa, the state of Hawaii in general, the Native Hawaiians are not the majority in any of those spaces. And so we have the beautiful opportunity to share our culture with other folks who call Hawaii home, whether that's for a semester in college or for a lifetime. And, one of the things that we like to say is, if you're in Hawaii, you're here for a reason, and there's something about Hawaii that you love, because it's expensive to live here. I mean, it is a challenge to live here, right? And I know the data that folks have been collecting, the HOPE data, for example, right, shows that this is a hard place to live in. So if we are here and we love this place, this is part of the work that we do to invite folks in. I don't care what color you are, where you came from, what your language of origin is, all of those things. If you are here, how can we work together to provide each other the most tools we can to take care of one another in this place? Gotcha. And that is the beginning of the invitation to anyone, because it's a struggle. And yet we know that there's something about this place that people love. And I think they want it to continue for future generations. And that's where we really begin the conversation. That's our connecting point, right? That is the thing that we call it a pico, or like a center, something that connects all of us, that we can say, if we love this place, how might we work together? How might you bring your traditions? How might we learn from the traditions of this place? to figure out how we can take care of one another to then collectively take care of our island home. And what we are seeing more and more in my lifetime, I am seeing that we are at a point now in 2022 that there are more people than ever before, that at least I know of, who are saying, yes, please. I don't have all the answers, but that is the spirit of the thing that I am here for. Can you please help me? Can I please help you? And that's really exciting.
Mm-hmm. It's very exciting. That phrase, if we love this place, how can we work together to take care of it? I mean, that is just so profound and so important. And thank you for sharing that wisdom, that ancestral wisdom with us. And we all hail from ancestral wisdom. I think we are trying to catch up with our ancestors in learning to live in harmony with our environments and in concert with one another. You mentioned our Hope Data Project, Puni, and it is an effort by the National Collaborative, by NCHE, to give folks an aspirational frame for not just, what are the inequities, but what do we need to do to close those gaps? What do we need to do to achieve health equity? And you brought up housing as a critical issue there in your place, in your sacred place. Could you say a little bit about what you might know about or goals you might have about making sure that housing becomes more affordable for the people there on the island, the people who cannot afford to live well?
Yeah, thank you for that question. I'm really grateful for the data. I'm still learning. I'm still trying to make sense of all that you folks have done in that area. It's actually a really beautiful model for some of the local initiatives that we wanna launch here. I want to start by saying, so my mom, she's also a professor, Lili Kalakame'elehiva, and her work, her research has really focused for a long time, based on her own experiences as a young child, with her mother, with my grandma, struggling to make ends meet to pay rent in Hawaii. And the idea of private ownership of land and paying rent is a very Western concept, right? Yeah. So we didn't have private ownership of land until 1848, at a time when actually Americans brought in this concept to Hawaii, and slowly things started to change. And really, there is argument about this, but I would say that there is definitely data to show that for the worse. Because when you believe that the earth is your grandmother, you do not buy and sell your grandmother. You take care of her. And I am definitely citing my mother and her work here. When you take care of her, she then can take care of you, right? She can provide you all the nourishment you need for your body and all the protection you need for your family. That's the beauty of what nature does for us. So when we started to, I'm going to say we collectively, people who were living in Hawaii during the Kingdom era, both Native Hawaiians and Chinese, Filipino, Japanese, and other folks who had moved here for different reasons, who were citizens of the Kingdom of Hawaii, this idea of private ownership of land was a little different. Yeah. Okay? How do we buy and sell this thing that has been our family for so long? Many Hawaiians, I'm just going to talk about Native Hawaiians for a second, although there are others. Many Native Hawaiians, this is how we lost our land. And this is the beginning of the physical health inequities that we began to experience, because we could not eat our foods anymore, because we were struggling in so many ways, all very connected to the loss of our lands and to the loss of housing. Today, more than half of Native Hawaiians live outside of Hawaii. We cannot afford to live in our own homeland. Mm-hmm. And so all of the spiritual and physical manifestations of lack of health really at this point that happen because we are so far disconnected from our homeland, from the things that we know make us healthy, our cultural practices. It is very real. It is very, very real for us. And it's not only Native Hawaiians, but local people in general here. And so thinking and being very creative and innovative about how we can create spaces where people can return to Aina, to return to land in ways where we don't have to buy and sell, is that the only model of living in place? And we know the answer is no. And so really working on policy and practice to allow that to happen is something I know I'm really proud of that some folks in our communities are leading right now. I hope that answers your question.
It does, and it opens, a door for future conversation, but
Yeah.
clearly you have the scaffolding in place for a vision for the future that brings the past into the present for designing a future that honors the past. And that's really truth, racial healing, and transformation. And it's clear that equity is at the center of that. I think we have time. I want to ask you one more question. Everything you've said has been about innovation, but innovation that's informed by and honors the principles and the culture of Hawaii, of Native Hawaiians. But can you share with our audience any specific innovative practice that you've put in place that you think has had a profound impact? And have you measured that impact in any way?
Yeah, thank you for that question. I think so. Like I said, at the heart of what we are doing is helping people to utilize, first of all, to understand concepts, Native Hawaiian concepts and practices that for a long time were really only for Hawaiians, for Native Hawaiians. And we are, at least some of us are saying, but what if we all lean into these practices? Not to say that you have to say that this is the only thing that matters, but what if there's another tool or another set of tools or value systems and worldview that you can integrate into the way you think about how you connect with other people as common human beings, how you connect with people and see your interconnectedness and your interdependence. Like, what if these are additional tools? And I think one of the things that we've been doing with this concept is helping people to map their relationships, to map the different lineages that they are a part of, that they have inherited things from, inherited lessons, values, practices, and also the way that they are really birthing them in the next generation. Whether or not that's, the way you, like a set of beliefs that you have about, how you raise your family, that is going to be birthed in the next generation. If it's a set of beliefs about how, the world was made and science, if you're a scientist in the university, I had this one professor go through a set of experiences with us where he doesn't have children of his own. And he had never thought about his students as the next generation as his offspring. But when we do this kind of mapping and really take some time to think about it, from a Hawaiian perspective, anybody of the next generation is considered your child. Anybody of the parent generation is considered a parent. And so inviting those pieces into the way we think about our relationships, our networks, right? We have some really Western concepts that do help us map. I think the difference that we invite folks into from a Hawaiian perspective is by saying, from a Hawaiian perspective, when you can make those connections and see those relationships, we call that family.
Yep.
And so when we consider that family, how do we treat one another? What are the considerations? How does that shift the way we might take care of one another? So that's part of the work we've been doing. So
Puni, could you tell us a little bit about the barriers or the obstacles that you had to overcome in order to make this center, this Truth, Racial Healing, and Transformation Campus Center come to life there? And after you think about that, could you also share with us your vision for the future of the work?
Yes, thank you. I think the biggest barrier, and this isn't, unique, I'm sure that you know this, is fear. I have some idea of what it's like in other places, but in Hawaii, it's really unique because on the one hand, we have intermarried so much that we don't look only one way or another, right? For example, my mother is Native Hawaiian, Chinese, and a mix of different kinds of Caucasian, ancestry. My father is English and East Indian. Okay, so that's why I look like this. And everyone in Hawaii, for the most part, has these beautiful stories of love, really, from different folks from different places in the world coming together. That doesn't mean that racism and inequality doesn't exist. And on the one hand, it means that we have this beautiful possibility for exploring all the ways that love can happen across different kinds of boundaries and borders. But we also have a lot of fear about pulling things apart and naming and identifying where things have gone wrong, you know. And because also we come from a culture, even the local culture that has developed over the last few hundred years, where we are not direct. We, in Hawaiian culture for sure, we talk about things in very kind of circular ways. We talk about things in ways that we don't even use the words you and me very often when we're in conversation. And so they become a little bit different. And so you put all those things together and there's a lot of fear. So there's a woman that I respect greatly. And when I first told her about the TRHT work, she said, "You must be crazy to try and do that work in Hawaii." And I said, "I probably am, but I'm also filled with hope because I have seen what aloha, what love can look like across boundaries and borders in Hawaii. And so there are pockets of this. But people are scared. And so I find that, you know, whatever we're asking anyone else to do, we do first ourselves, right? We use circles, we use all the touchstones from the circles in circle and in life to really try and invite, like I said, you know, invite folks in. We handhold, you know, and we use this idea of lineage and genealogy to honor everyone's genealogies and all the stories that have shaped us, and to say we all have these stories. We all have connection and disconnection. And so we try and start there. So that's been one of the challenges. Can you repeat the second part of your question?
I will. I just want to respond to what you said in particular, because the resistance, you know, it's part of the change circle, I call it. You know, you're going to meet resistance, and that might be a better word than barrier, but it sounds like you have used the work itself to overcome the resistance and to invite people in, and to invite them into a place that is value added for them in terms of compassion and affirming their humanity, their family humanity. And so it works. It appears that it works, and it helps to break down and counter the fear. You know, there's some spiritual traditions that say, you know, the two emotions are love and fear. And so if you can counter fear with love. And that's basically what you've said and demonstrated. So thank you so much for that answer. The other part of my question had to do with, you know, imagining where this work will be in 5 years or 10 years. You know, just push the envelope a little bit. Might it be, you know, legislated? Might it be something that happens at a statewide level? Or might it be, you know, expanded to other campuses? Just share with us what your vision is for the future of your work.
Yes, thank you. I mean, I think there's a couple of things. Our vision for our center, you know, if I can start there, is that one day every single person in the university, but also in the community, will know their particular, unique, but also collective. We use the word kuleana to describe their role, their responsibilities, and have the tools, right, to then live into their responsibilities and their privileges, to take care, to aloha one another and place. That's our goal. That's our vision. That we don't care where you come from. If you are here, you have the tools to aloha one another, to aloha place. And so, you know, in the next 5 years, a lot of this work has been done, you know, in lots of volunteer work, you know, lots of like on the job training. And so one of our goals is that, you know, that every single, we call them ahupua'a, they're a type of land division, but for lack of a better term in English, we'll call them communities. That every community in Hawaii, we have about 1,800 ahupua'a from this. It's like a Hawaiian geographical way of mapping. But every ahupua'a has at least one pair of trained racial healing circle co-facilitators. So that's one of our goals, and that we are growing the capacity of folks to be in their own communities, holding their own space, and helping people connect within their spaces. And this was inspired because we were starting to get questions, we were starting to get requests to go into other communities to hold space and to hold circles, which we were happy to do. But at the same time, I thought, but I'm not from that community. And wouldn't it be beautiful if folks from their own communities had the tools to hold the space they need? And so that's where that vision was born. And so we're on our way. We have a 2-part goal. One, to have a pair of co-facilitators, at least one pair for every Ahupua'a, but also that every unit in our university also has their own pair of co-facilitators. That's one thing. And then there's a lot of capacity work that we're building on in terms of the ways that we invite folks in, and having many people who can hold the kind of space, not only to do circles, but to engage folks in the native mind concepts I shared with you earlier. And then, of course, pairing that with policy change, both in the university, which we are working on, that is actually underway, and in the legislature. And we already have some really beautiful pieces in the legislature that we can build on. I think we need to work on the ways we think about accountability and enforceability across the state.
My goodness, that is such a powerful vision. And I'd love to see that vision transplanted, stateside, so that every city and county and state that this work is happening in, every one of them could have a vision that there would be at least 2 people to co-facilitate and to convene the circles of compassion and elevate and lift up the capacity, to have the skill, the tools to learn how to see ourselves in one another, to learn how to reconnect. So I thank you for sharing that vision. And I hope that some that are listening who are doing this work will transfer that vision to their own places and to their own communities. How long has this work been going on there at your university?
So we became a TRHT center in 2017. And, with the first cohort. And so we have slowly been, looking at, I want to respond to the question you asked earlier about barriers or challenges, or, I think one of the things that's connected to this, this beautiful work that you have led, so amazingly, and has inspired so many, is that we still are trying to communicate. And this is, of course, where data comes in, and we're really trying to figure out the best ways to measure the progress, is to communicate the value, because there are many spaces where folks don't think that the heart work is important, as and I think that's connected to the fear piece that I spoke about. And so trying to, communicate that as we move forward, while, we invite, and while, the best thing in Hawaii, I don't know about anywhere else, is the power of the story sharing, right? When someone has experienced something, the way that they share that with others, and that becomes part of the invitation in. But really being able to communicate the value of this towards larger, goals like health equity, towards social justice, towards housing, like why all these small pieces, and I don't mean small, why the individual connections, right, over and over and over again matter. And, you're modeling that for us, and you're teaching us how to communicate that.
But thank you for sharing that, because we can do a better job of documenting the science, the Western science that undergirds the understanding that these connections are vital to the heart rates, to the circulation, to the sympathetic nervous system, to the polyvagal system, that these connections make a difference in terms of our physiology, and that difference translates into less vulnerability to illness, so we can do a better job, I think, and what you've just expressed is a challenge, I believe, to the field, to do more, to document the positive benefits and importance, indeed the primacy of the work of the heart, the work with the hearts. When we do that work and do it well, it will help us to avoid the hatred and the violence that besets our societies. So thank you very much for lifting that up, Puni, as a challenge that we all have to rise to if we're going to achieve the transformation that we hope to achieve.
Well, I just want to say thank you, because every time I listen to you talk, every time I read something that you've written, I am quoting it. I am, elevating it to be like, let me help you connect the dots the way Dr. Christopher is helping me connect the dots. Because you're right, it is so extremely helpful, and it is that kind of science is really valued, and it should be. That's beautiful too. So just so much gratitude to you and your teams for continuing to help us do that.
Our pleasure, our honor. And you're reminding me that it's been over 10 years since I visited Hawaii. And so I'm planning to come and visit. So I will connect with you when I do. Thank you again so much.
Thank you.
You've been listening to NCHE Presents Leaders Pursuing Health Equity in America, a podcast hosted by Dr. Gail Christopher, Executive Director of the National Collaborative for Health Equity. Through resolutions, executive orders, and other mechanisms, local leaders are declaring racism a public health crisis and committing to addressing systemic health and racial inequities. Follow NCHE on all social platforms and visit nationalcollaborative.org to learn how you can implement truth, racial healing, and transformation in your community.